The number 100 can seem like a lot, so much so it's often a cause for celebration. A century or a centennial, turn 100 and you get a card from the Queen. But when it comes to the general population, it's a drop in the vast ocean. Fewer than 100 people. 100 people in New Zealand cannot have the vaccine for medical reasons. That's around 0.00025% of the eligible population. That means it's safe for almost everyone. Another cause for celebration. So what makes it so safe? And for more on this, we're joined by Dr. Nikki, Director of the Immunisation Advisory Centre. Great to talk to you, Nikki. Can you tell us what is in the Pfizer vaccine and who is it unsafe for?
Kia ora, yes. Well, this is a modern vaccine and it's really good that it's actually got very little in it. So you've got a little piece of genetic material, which is what the body recognises and responds to. That is wrapped in a coat of fat. So it's like in a little fatty bubble. And then really the only other things in this vaccine is it has some salts, and that keeps it stable to the acid match of our body. And then it's got some sugar products in it, which enables it to be stable when it's frozen. That's pretty well all that's in the vaccine. So it's very simple, not a lot of ingredients. So your next question was, who can and can't have the vaccine? Now, there's actually very few people that can't have this vaccine. There's no virus in it. There's not even a piece of virus in it. So this vaccine is safe for almost everybody. There's a really small group of people who can't have this vaccine, and they are people who have had a severe allergic reaction, what we call anaphylaxis, to any product in the vaccine, or who had a severe allergic reaction to the first dose. Now, the products in the vaccine aren't very much. There's one product that's called PEG, polyethylene glycol, for those who are really interested in the chemistry. It's a product that's used quite widely in a lot of medical products, and so we've got extensive use of it, and there's a very, very small group of people in the country who have severe allergic reactions to it. So those people, we're very cautious about using this vaccine on. Look, there's hardly any. There's less than 100 people in the country at the most who would genuinely have a severe reaction that we would say, oh, you shouldn't have this vaccine. So it's a great vaccine. The question that people often ask is, well, look, I've got a really bad medical problem, I'm on a drug, my immune system's not great. Is it safe to have this vaccine? And the answer is yes, it's not safe to have the disease for those people. And because the vaccine has no virus in it, no live virus in it, it's really, really safe for people on any medication, for people with severe problems with their immune systems or any major medical problems. So really good news for the vast majority of us.
Nikki, what about anyone who's pregnant or breastfeeding? Is it safe for them?
Yes, this vaccine is definitely recommended highly for pregnant people and breastfeeding people. Many people would have seen the news internationally that pregnant people are getting really sick from COVID. So it's really, really more important for pregnant people to have this vaccine. Again, it's not a live vaccine, there's no virus in it. Really safe for the mother and really safe for the fetus. The other really cool news about having this vaccine in pregnancy is that you'll create antibodies, protection, that will cross the placenta and go to the baby as well. So we hope from that your baby will also get some protection from being pregnant. In the same way, we're sure it's a really good thing to breastfeed your babies and to be vaccinated while you're breastfeeding.
Thank you so much, Nikki. Fantastic to talk to you.
My pleasure.
ASB and 7 Sharp. Keeping